You are welcome to my channel. Thanks for visiting. Today is about Penicillin V Potassium. Maybe you are familiar with Penicillin Penicillin, PCV, or Penicillin VK. Well, don't worry, it's all about Penicillin V Potassium. Without further ado, let's get all the facts. Nomenclature. Penicillin V Potassium could be written in some texts as Penicillin, Penicillin V or PCV, or Penicillin VK. It is all about Penicillin V Potassium. Another fact is anaphylaxis could be common here, particularly any history of hypersensitivity up to the level of anaphylaxis against penicillin in any individual. Take note, it will still occur here. Penicillin is penicillin. Now, even in other antibacterial, under the group of beta-lactam, don't worry, I will explain further about cross-reactivity. But there is open door for penicillin desensitization. I have a separate presentation on that right here. If you want to get penicillin desensitization done, you can click on this link. Usually, when Penicillin V Potassium is prescribed, it will be every 6 hours, but it could be every 8 hours or twice daily. You will understand all this in a bit. It could be under these brand names and even more, depending on the one available in your jurisdiction. It belongs to the class of agents known as antibiotics, specifically oral penicillin. Antibiotic coverage is going to help with gram-positive antibacterial, but not all of them. It's less effective against gram-negative, but could be useful in gram-negative anaerobic agents. It can handle some spirochetes. However, don't bother your head. Just do one thing. Do microscopy, culture, and sensitivity test. Then you bother your head less about whether these antibiotics will cover the agent you've isolated or not. It could appear in the form of tablet for per as generic type under the strength, or solution to be reconstituted for per use at this strength. Administration. It is expected to be taken per on empty stomach. That will help. But if in any case you cannot, create at least 2 hours between the time you have taken the meal and the antibiotics, or you've taken antibiotics and the meal. Keep serum level or trough the same by giving it around the clock. That is why most people will prescribe these antibiotics as every 6 hours dosage frequency, and take plenty of water with it, please. Mechanism of action. These will bind to penicillin binding protein. When that happens, it has the capability to inhibit the final transpeptidation of the peptidoglycan synthesis, meaning the final transpeptidation will not occur. And when that is the case, the synthesis of cell wall is inhibited, is blocked. When cell wall formation is no longer taking place, there will be no cell wall. Then the bacteria is open to autolytic enzymes. And with that, there will be eventual cell death. Uses. We can use it as a prophylactic agent while battling with anthrax. I'm not saying for treatment, okay? We can only use it to treat cutaneous anthrax. When it is systemic anthrax, you go for another agent entirely. But for prophylaxis, yes. In rheumatic fever, Prophylactically, yes. Asplenia or sickle cell disease, bite one, meningococcal or pneumococcal infection in cancer patients with hematopoietic stem cell transplantation. You can use this medication for prophylaxis here. Still on uses, a patient with prosthetic heart valves trying to undergo dental procedure can take this medication 1 hour before that specific procedure and a repeat at 6 hours post procedure, that is post dental procedure in people with prosthetic heart valves. Now, uses of Penicillin V Potassium for treatment. Okay, in cutaneous anthrax treatment, you can use this. In diphtheria, but you have to combine it with antitoxin. In community-acquired pneumonia, you can use this. In acute gingivitis, erysipelas, and actinomycosis. Even at this stage, with actinomycosis, you use a very high dose. Still on uses, in pharyngitis with streptococcus or prosthetic joint infection, beta hemolytic strep infections, penicillin-sensitive enterococcus species, Cotibacterium, or spirochetes, Vincent's infection. Note: be cautious in the face of renal and hepatic impairment, please. Now, in pediatric age group, when we are faced with community-acquired pneumonia, you can go for these strains every 6 hours. If it is sickle cell disease patient or asplenia and you want to give it prophylactically, in less than 3 years, you can go for this strain. In greater than 3, you can go for this strain. In anthra-prophylaxis, you go for high dose, please, as high as 50 to 75 mg per kilogram per day, but in 4 or 3 divided doses in pediatric age group. Generally, in pediatric age group, we use it for mild to moderate infections, and the child should get between 25 to 50 mg per kilogram per day in total, but must be divided into 4 divided doses. In adult, can go for this strength every 6 hours or every 8 hours for 7 to 10 days, or 500 mg per hour every 12 hours. High dose is expected when we are dealing with actinomycosis, as high as 250 mg to 500 mg every 6 hours, meaning about 2 to 4 grams every 6 hours for 8 weeks when dealing with actinomycosis. Now the side effects. I cannot overemphasize hypersensitivity or anaphylaxis. Penicillin is known for that. So in anyone taking this medication for the first time, please keep an eye for hypersensitivity or could progress to anaphylaxis. It might be toxic epidermal necrolysis, Stevens-Johnson syndrome, or erythema multiforme. Cross-reactivity is possible with beta-lactams, like cephalosporin, other penicillins, monobactams, or gabapenins. So, someone had never taken penicillin before, but had taken cephalosporin, and he or she had developed hypersensitivity reaction to it, might be anaphylaxis. Today, you should not give this penicillin. The same if the history has occurred that the individual had taken penicillin before, but not penicillin V potassium, and he or she had developed anaphylaxis, hypersensitivity. It might even be any of the monobactams or gabapenins. once there is history of hypersensitivity or anaphylaxis in anyone taking any of this in the past, expect the same to occur today. Other possible side effects will be oral candidiasis. Remember, we have normal flora, all over the body. But when you are taking penicillin for a long time, you tend to kill the normal flora, and then the fungal infection will thrive. Oral candidiasis. There may be nausea, vomiting, diarrhea, or constipation, including abdominal pain. Other possible side effects could be thrombocytopenia, that is low platelets, hemolytic anemia, that will present with positive Coombs test, convulsion or seizures, but these are rare, not very common. But truth be told, that could occur. You can experience changes in your tongue. It could become swollen, black, or hairy. There may be rash or itchy. Remember, hypersensitivity, right? Vaginal discharge may occur. Hepatic damage may be the case. Bruising or bleeding from thrombocytopenia or hepatic damage. Other possible side effects that will be mild will be fever, chills, numbness, tingling, heart racing, unable to sleep, you lost appetite, and later on you lose weight, and of course dry mouth. Now, contraindications. I have repeated this over and over in the last 10 minutes or 12 minutes. Hypersensitivity is a possibility, and when that occurs, or there is history of that, no more penicillin V potassium, except desensitization has occurred. I have said, and I'm repeating, cross-reactivity is possible. With cephalosporins, with beta-lactams generally. Cephalosporins, carbapenem, monobactam, other penicillins, and be careful. Because someone can say, oh, this patient had never been sensitive to potassium, V penicillin or penicillin V potassium in the past, is only sensitive to cephalosporin, cefazolin, or whatever. Cross-activity is a possibility, please. Once, again and again, anaphylaxis to penicillin or beta-lactam is opening door for another anaphylaxis when you use penicillin V potassium. You should be conscious in asthmatic patients because there may be hypersecretion when there is anaphylaxis, and asthmatic patient will pay dearly. Fungal superinfection is a possibility from the explanation given on oral candidiasis. You can pause, rewind, and get that explanation once again. Now, oral formulation can contain phenylalanine. This will be a problem for anyone with the history of phenylketonuria because already they have phenylalanine getting accumulated. Now you are exogenously introducing more phenylalanine. So in anyone with phenylketonuria, you will not give a brand with formulation containing phenylalanine. In pseudomembranous colitis, that will be a big problem here because pseudomembranous colitis with C. difficile, formerly Clostridium difficile, now known as Clostridioides difficile, could be the complication. And we should be cautious in anyone with seizure disorder, including renal or hepatic impairment. Remember, I've stated earlier that seizure disorder or convulsion is part of the rare side effects. Gasping syndrome could be the case in infants if the formulation contains benzyl alcohol. High dose for a long time can lead to serum sickness, hemolytic anemia, or even neutropenia. Drug-drug interaction. I will lead that to pharmacists or clinical pharmacologists and anyone taking birth control pills. There may be failure, particularly oral contraceptives. Pregnancy and breastfeeding, it is okay, but confirm with your OBGYN specialist or pharmacist. Monitoring. Yes, you are given the first dose. Please watch out for anaphylaxis. Clinical state of the recipient will determine whether you are winning or not. Have complete blood count done. Remember, hemolytic anemia and neutropenia is a possibility even with thrombocytopenia. Coombs test could be done. Remember, it could be Coombs positive. I've talked about hepatic impairment and renal impairment, that you don't use this medication under those circumstances, right? In conclusion, this is a medication that is very helpful, only to be used as when it is needed. Be sure that there is no hypersensitivity reaction in the past to any of the beta-lactam antibiotics. If not, cross-reactivity may occur today. And finally, discuss with your pharmacist or clinical pharmacologist while trying to prescribe this medication. With that, I've come to the end of this presentation. Penicillin V Potassium is a good antibiotic. It's not meant to cover all. It doesn't have broad spectrum covering gram-negative. It's not so effective against gram-negative. And it's not effective against all gram-positive. So, do your microscopic culture and sensitivity test. With that, I've come to the end of this presentation. You are free to prescribe this, but please be cautious. Appreciate. Share with your friend. Thank you.